All right, ladies and gentlemen, you're listening to the We Be Free radio show, Brain Food from the Heartland. I am delighted to have returning to the show a favorite guest of mine, Dr. Jeffrey Singer. Doc, good morning. Welcome back.
Good morning. Happy to be here.
Delighted to have you. A little bit, I always ask a little bit about your background, if you would.
Well, I'm a general surgeon in private practice in Phoenix, Arizona. I've been practicing surgery for about 40 years now. But I'm also a senior fellow at the Cato Institute. In recent years, I've cut back on my practice to part-time, and I'm full-time in policy work at the Cato Institute in Washington, D.C., which is a libertarian think tank that studies public policy and comes up with policy proposals that move things in a more direction and more consistent with freedom.
You know, I wonder about libertarianism, if people really understand it, because to me, it's the best. I remember voting for Ron Paul. What was it, 1988? I think president. Was it 1988? And I remember there was a local group of libertarians. I put my yard sign in. Somebody took it. I put another one, and someone took it. Then I put it in the front window inside. Because I don't know why they were taking my Ron Paul signs, but nonetheless. And from what I understand about, you explain libertarianism, if you would.
Well, first of all, I'm talking about small L libertarianism, which is not the political party.
I understand.
It's a philosophy, and basically, it's a philosophy that's very compatible with the philosophy of the founding of this country. We believe in the only proper role for the government is to protect everyone's inalienable rights to life, liberty, and the pursuit of happiness, and to prevent other people from interfering with your right, your ability to exercise those rights, to provide a court system where people can peacefully settle their disputes, and to provide for the defense, to protect us from attack from people outside of our borders who want to hurt us. But otherwise, we want to have a maximum of freedom, and that means not just keeping the government out of your wallet, but keeping the government out of your bedroom. Your personal lifestyle decisions and life choices are your personal choices. Everyone owns themselves. Everyone owns their body, and basically the best government policy is the policy that protects that. Also, societies, to the extent that societies honor those principles, those societies tend to be very affluent, and they create a lot of wealth and well-being. You see, there's a definite correlation between the amount of human well-being and human freedom around the world. The freer a country is, the more prosperous a country is.
And again, I love the philosophy, and I'm glad you said that about the small L libertarianism. We're not talking about the party per se. Yeah, right. Advocate for, again, personal freedom, as long as I'm not hurting someone else.
Right. Yeah, anything that's peaceful is one of the expressions we use.
Yeah,
and so libertarians, when it comes to the area of foreign policy, again, that's informed by that. We have recognized since, and as did our founders, that war, aside from killing people and destroying wealth, which is very evil, war also grows the state. Of necessity, the state has to grow in power because it has to prosecute the war, and people have to surrender a certain amount of their freedoms in order for the state to prosecute the war. And then after the war is over, things never seem to return to their pre-war levels. The government retains a certain amount of increased power. The people have surrendered a certain amount of freedom, and both have gotten used to that. So there's the general kind of predisposition, the default position of libertarians when it comes to foreign policy is this necessary for us to risk going to war over? Sometimes the answer is going to be yes.
Sure.
But most of the time, the answer is going to be no. And because we realize that there's a permanent price that's paid for getting involved in wars.
Yeah, you don't go back. Doesn't go back. Right. And the freedoms that you give up today are not returned tomorrow or whatever. I could go on and on about it, but
right.
I appreciate that. Getting involved with Cato for you, Dr. Singer, How did that happen?
Well, like I said, I've been a libertarian since I was an undergrad back in the, I'm afraid to say, the early 1970s. And the Cato Institute was created in 1977. And I became quickly aware of that and started reading material coming from the Cato Institute and aligned with it. And then eventually I became a supporter of the Cato Institute. And then as my practice matured and the size of my practice grew from a solo practice to a large group of surgeons, we each got more, allowed ourselves a certain amount of personal time, which is important. And since this has always been a very important issue to me, I use my personal time to get involved writing and speaking out on issues from a libertarian perspective. I became an adjunct scholar at the Cato Institute. And then in later years, as I grew older, I decided to cut back my medical practice and amp up my involvement in public policy. And the Cato Institute took me on as a senior fellow. So I'm working full time for the Cato Institute now.
Cool. I'm going to ask you, where do you think that comes from in Jeffrey Singer? Because again, you built a beautiful medical practice, very successful in practice. You could kick back, correct? And just,
yeah.
And
I'm still practicing, but not to the extent.
I mean, not get involved. You made a choice to get involved, Cato, a drive from within you to speak up.
I don't know. It makes you wonder. I came from a blue collar family. My parents were first generation Americans. I was the first one in my family to go beyond high school. But even though my parents and grandparents didn't have advanced educations, they always took current events and political philosophy and those kind of things very seriously. As a child, I witnessed these very animated conversations around, the dinner table when we were getting together with relatives, half the time understanding what they were discussing, but understanding that apparently these things are important. So that I'm sure has something to do with it. And I guess there's this, I hate to sound not unscientific, but I think certain people are wired a certain way.
Yeah.
So, it's these things always meant a lot to me, enough to me to spend a lot more of my time on it than the average person does. When I grew my practice to a group practice, my partners would use their personal day off the way probably most normal people do. They get a haircut, go play some golf, get together with some friends. It was their personal day. There was their, kind of time to recharge. And me, I would use that day to write, get op-eds and go speak at conferences. And that was my way of kind of recharging, I guess. So a lot of it, I think, has to do with the way you're wired as well.
And and asking that, it's got to be, it's certainly difficult to answer, because if someone asked me what would make it, I don't know, I could get some anecdotal stuff from the past or whatever. And by the way, those discussions around the table when you were young, I'm guessing were probably much more civil than the ones of today.
Well, there was no name calling, but they would actually get pretty heated,
sure they were,
passionate. People would be passionate, but we were all relatives. So usually after, a lengthy animated argument around a dinner table, it would move to something else that'd be more like a family matter or something.
But you didn't, I'll use the expression of today, unfriend someone.
No.
Opinion of yours. And I'm guessing people listened. I find people.
People actually would, change each other's minds sometimes.
Yeah. That's one of the things I get, that a topic for another day. When people get into certain so-called news outlets or certain feeds on their computer or phone or whatever, and don't entertain any other possibilities.
Yeah, it's really important. I make it a point of trying throughout the day when I'm working in these areas to read viewpoints that don't agree with me, because maybe it's because I was raised I was educated in the sciences, And in the sciences, at least up until, the last year or two with COVID, you always wanted people to kind of double check you to make sure, did the answer I come up, is that the right answer? Because we all want to know what the right answer is. So I came up with this answer. Go over this and tell me if you think I made a mistake. That was the kind of attitude. So to this day, every time I think I know the answer when it comes to, public policy or political issues or whatever, I like to read smart people who have alternative viewpoints, not dumb people who are just shouting epithets.
Yeah.
Smart people who are making arguments on the other side, because I don't know, maybe I got something wrong. Maybe I missed something here. I want to know. I want to feel confident. And I know that every human being is fallible. I've been wrong before, and I'm going to be wrong again. So I'm very interested in hearing other perspectives. That's the way everybody should be, in my opinion.
See, and I agree. I'm very much like that, certainly on a different level because of your education, but I'm like that. I want to, and I was just saying this earlier this morning, I love the experience when it's like, wow, I never thought about it like that.
Mm-hmm.
And I like to read things that are different. And these days, if I hear a story or something on any of the cable networks, and be it MSNBC, CNN, even I dare say BBC, Fox, Newsmax, whatever, if it's important to me, if it's interesting to me, I still want to trace down. I want to get the facts without the commentary, I guess I should say.
Yeah, I agree.
Source it. Yeah. And I think that's important, something that people don't do often enough. Obviously you do, but don't do often enough. So let's talk a little bit. You've got a number of pieces, by the way, and I would urge people to read your pieces that you've got up at Cato, et cetera. But let's talk about the Hippocratic Oath. Again, that was one, when you and I were communicating, I never thought about it like that. That's a perfect example for me.
Yeah, well, I have something that came up on the Cato website a week ago today, actually, called the Hippocratic Oath for a Free Society. And the reason I did this is because many people may be aware that, well, maybe they're not. So let me just start from the beginning. So the original Oath of Hippocrates was composed in the 5th century BC. And Hippocrates was considered the father of medicine, and asked people in the field to take an oath. Around the late 1800s, a lot of medical schools, both here and in Europe, as a ritual at graduation ceremony, would ask graduates when they're handed their diploma to recite sort of an updated version of that oath. And in recent years, a lot of medical school faculty have been allowing the students and the faculty to write the oath instead of recite an oath that's given to them. And that's gotten very controversial. Now, back in the 1964, a professor, Louis Lasagna, who was the dean of students at Tufts University Medical School, he composed an oath, and that's the one that was taken by most medical school graduates in the latter part of the 20th century, including me. In Europe, there was a Declaration of Geneva, was an oath created by the World Medical Association. They're both very similar, and they focused on, they were all self-indulgent. They focused on, I will be a noble member of my profession. I will first do no harm. Those kind of things that most people are familiar with. In recent years, as students and faculty have come to write oaths, they've gotten much more focused on social justice issues, to the extent where in some cases, they don't even really talk very much about the practice of medicine. They talk about undoing injustices and the like. So that generated a lot of controversy. And May is the month that a lot of medical schools are graduating the class of students. So that got me to looking at all these oaths, including the one I took, and even the Oath of Hippocrates. And I realized, this controversy that's been generated is kind of beside the point, because none of these oaths, including the Oath of Hippocrates, put the focus where it belongs, which is on the patient, on patient autonomy and respect for the patient as an individual. Because I believe that we doctors, there's a tendency right from the days of Hippocrates for doctors to look at patients much the way parents look at children. So they're very paternalistic and they're guiding them. And I believe that we should look at patients, I'm talking about adults, as clients. You know, they're asking me for my best advice and for my help, but at the end of the day, they're the boss. But just to give you some examples of recent commencement Hippocratic oaths that have garnered a lot of attention in the news. The University of Pittsburgh Medical School, another thing is a lot of medical schools since the 90s have had what they call a white coat ceremony. So the students take an oath when they begin school, when they put on their white coats. And then in many cases, they take an oath again at graduation. Some schools only do white coats, some only do Hippocratic oaths, some do combinations. But in some cases, they call it a white coat ceremony. So the University of Pittsburgh white coat ceremony oath in 2020 said, "This oath is the first step in our enduring commitment to repairing the injustices against those historically ignored and abused in medicine. Black patients, indigenous patients, patients of color, and all marginalized populations who received substandard care as a result of their identity and limited resources." And it also pledged, listen to this, to respect patients' role as a vital member of the healthcare team. So in other words,
Wow.
the doctors, you're as a patient, you're a member of the team. So you get to have a little bit of say in things. You're part of the team, which is, to me, that's the part that stuck out. What do you mean? So you're being kind enough to recognize that I should have a little bit of input in what you guys do to me. So that's the part that jumped out at me more than the other parts that got a lot of attention on cable news networks. And the University of Minnesota Twin Cities in last year, their white coat ceremony started off by recognizing that their medical school is located on Dakota land and is committed to uprooting the legacy and perpetuation of structural violence within the healthcare system, and to honor all. Yeah, this is the oath in the University of Minnesota Twin Cities Medical School, and to honor all indigenous ways of healing that have been historically marginalized by Western medicine. In other words, unscientific. And not only they commit to healing the sick, but quote, healing our planet and communities. You know, I never, that's pretty ambitious. So, but the point is that you can criticize these, but nobody's talking. Even the Hippocratic Oath talked about, Hippocrates said that he, you know, that I will only share the information that I've learned, the knowledge that I've learned, with the sons of my teachers and the members of my profession, and no one else. Which kind of anticipated the modern day cartel that exists in medicine, where it's a closed off society, almost like a priesthood. When other healthcare professions want to get in on taking care of patients, be they nurse practitioners or prescribing psychotherapists or optometrists, you see resistance from the medical profession at the state legislature trying to restrict them and not let them provide healthcare to people because they're trying to keep it as a closed group. And of course, they'll argue that they're trying to protect the patient, but in fact, they're really protecting themselves, because if they thought of the patient as a sovereign, autonomous individual, then they would recognize that they have no right to prevent patients from seeking advice from people outside of their own profession, and maybe even seeking services from those people, because at the end of the day, the patient is a sovereign, autonomous adult. So I had a discussion about that, and your listeners could go to the Cato website, cato.org. And as we're speaking right now, it's still on the home page. So when you open up, you'll see it. It's called the Hippocratic Oath for a Free Society. And I actually suggest, and as long as medical school administrators are now allowing students to prescribe, compose their own oaths, I suggested one that they may want to consider that I composed, that puts the patient first and respects autonomy. Listeners are welcome to go look at it and see if they agree with me on it or not. But it's called the Hippocratic Oath for a Free Society.
Tell us a little bit more about that. I've got some personal comments I want to make
about my oath, for example.
yeah.
I'm actually I'm getting it up right now because it's a long one, so it's not committed to rote memory. But for example, I say things like, I will never examine a patient or perform a diagnostic test or procedure without informed consent, even if they act against my advice and I disapprove of their choices. I will respect the right of my patients as autonomous adults to self-medicate and I will oppose any laws and regulations that force them to seek my permission or permission from any other health professional through a prescription or otherwise to consume medications or treatments according to their independent judgment. I respect the privacy of my patients, for when they disclose their problems to me, they expect and deserve confidentiality. I also talk about how if a patient's engaged in lifestyle choices or use of substances against my advice that I disapprove of and I deem harmful, I'll offer them advice, medication, equipment, and techniques to reduce the harm that may come from their choices, but I will not morally judge them. I will not morally judge patients with substance use disorder, addiction, or other behavioral health problems, but I'll treat them with dignity and compassion. In my oath, I say I'll oppose all efforts and existing laws and regulations, including professional licensing and scope of practice laws that limit patients' freedom to choose a health plan or a health arrangement, or prevent patients from seeking advice or care from non-physician health professionals, regardless of the type of healthcare service such professionals offer, and irrespective of their level of expertise and training. And when it comes to treating, for example, when it comes to sharing information, I talk about I'll gladly share any knowledge I have gleaned from years of research, study, and clinical experience with health professionals in all disciplines, because I'm not trying to keep this for myself. I'm interested in sharing whatever knowledge I've been able to gain on how to fight disease and suffering. So that's the kind of stuff I talk about in my recommended Hippocratic Oath.
I've got if you don't mind, Dr. Singer, I'm going to share some more recent personal experience that I've had. And I have shared with my audience my diagnosis last year of Lewy body dementia. And I've learned so much over the past year. And I know they talk about chasing a diagnosis, how difficult it is. I don't fault anybody with that, because I don't want to make this all about Lewy body. I understand it's difficult. I understand some of that, because people say, well, aren't you upset that you didn't get diagnosed when you first? No, it is what it is at this point. Yet there are things that I have learned. Oh boy, I better be careful. To find a doctor. And when you said that team, it's interesting, because now I have a team. I don't consider myself it's a team that I don't want to go there. But
I don't think you're a team member. I think you're the person they should be serving.
Yeah, I'm the patient. So I don't, but I do like sometimes when they say, well, I'm glad to be part of the team, because it's a team effort with this. But the understanding for me is that, and first to find a doctor, and there's a couple of them that actually listen and feedback, and you can tell they're taking it in and listening and responding, is a wonderful experience. I know that should be common. That has not been my experience, but I've got a few on the team now that are just amazing and will listen. Yet the bottom line, I'm probably going too far out with this. I'm not concerned at this point with the movement disorder, the Parkinsonisms as they talk about. I have some issues sometimes. I'm not concerned. The drug that they give you, and I'm not faulting the medical profession for that, increases the hallucinations on the Lewy body side. Well, I don't want to have the hallucinations. So if I stop taking the one and my movement is okay with me, that's my decision.
Right.
I don't know if I'm making any sense.
No, you're right. In
I've
fact,
got to look at it and do my research. And again, not the Dr. Google stuff, by the way. That it's got to be very irritating to physicians. I have a friend that's a veterinarian, and I was talking with him once about something for one of our rescue rabbits, and he pulled his coffee mug out and peered over and said, "Please don't confuse your Google search with my veterinary medical degree." So, because there's a lot of bad information out there, I get that, but you try to research it, and I have to find out what's best for me.
right. And, every
Makes sense.
decision involves trade-offs. In fact, in another part of my oath, I say my responsibility includes helping my patients to weigh the trade-offs, making their personal risk-benefit analysis when deciding on a therapeutic course of action, and respecting whatever their ultimate decision is. And that's, I mean, at the end of the day, it's my patient who's got the problem and has to make the decision. And even what I recommend is going to involve them making some trade-offs, and maybe they'll decide that it's not worth the trade-off to them. That's, who am I to judge that? I'm not them. That's their decision. My job is to give them best advice and best information I have, and not hold any information from them.
And I know you listen again to find ones that will listen and understand, because I want to be straight up with them and tell them what I am taking, what I'm not. I don't think it wouldn't be right to go say, yeah, I'm taking this when I'm not, when I've stopped. Yeah. The doctors and the team needs to know what you actually are doing. I get that. And to find those that understand it. And I'm reluctant to use the word respect, just understand that I've got to make the decisions that work best for me.
And that's respecting patient autonomy. There's a tendency throughout medical education, at least since my day, I'm sure before my day, like I say, is a paternalistic tendency. There's a tendency to look at the way we're taught as medical students. We tend to view our patients the way a parent would view a child. Mm-hmm. So you'll have doctors having conversations, in the lounge. I mean, professional conversations about how to treat a problem. And I know they don't mean it, but the words they choose are things like, I won't let my patient do this, or I would put my patient on that and do. Now, I know they're talking in shorthand and they're saying, I would recommend against my patient, but a lot of times the way it comes out almost betrays a certain attitude. You know what I'm saying? When you say, I won't let my patient do that, you can't not let your patient. You could strongly advise against it, but you can't say, I won't let my patient do that. But so when doctors speak that way to one another, when they're discussing how do you treat this or that, it kind of gives away what their underlying attitude is about their patients, I think.
That's interesting. I'm talking with Dr. Jeffrey A. Singer. You can go to Cato for more information. Of course, we've got those links up. And Dr. Singer, when you talked about some of the ones that are out there today that talk about, and listen, I love the idea of healing the world and Tikkun Olam and et cetera, et cetera. I know that they're looking at it differently, but I love those ideas. Yet, do they really belong in the?
Well, that I would argue that, and some people may say, well, you're just an old curmudgeon. But I would argue that has nothing directly. If you're going to have an oath at all, now you don't really have to have an oath. It's just a ritual. Yeah. I'm much more concerned not about the oath my doctor takes, but what my doctor knows, and my doctor's judgment. And so that's more important. The taking the oath is more just of a graduation ritual. But I think it's not unreasonable to think, well, if you're going to have a ritual oath that you take when you are officially getting a degree as a doctor of medicine, you would like to see the oath have something to do with practicing medicine. So as opposed to political activism or something like that. I mean, I don't care what the politics of my patients are. And I would like to think my patients don't care what my politics are. We're here to talk about what do we do about this health problem? And that's really what the focus should be, in my opinion. But be that as it may, I thought rather than get involved in a culture war issue, which is not likely to lead to anything positive. I noticed when I was looking at not only these newer oaths, but even the oath that I took and the oaths that have been taken since they've been having oaths, that much more important is that nobody's been paying attention to respecting the patient the way the patient should be respected. It's all very self-indulgent. It's all about our profession and how we will behave and all that kind of stuff. And also about we will also kind of close off. We will, to this day, for example, the American Medical Association, which many people may not know, when it was founded in the 1840s, it was founded with the express mission of getting all doctors licensed. Back in the 1800s, if you went to a state legislature and said, we think you should license either medicine or even carpentry, whatever, the legislators would look at you like you had two heads. They'd say, what, license? You don't need permission from the government to go make an honest living. By the late 1800s, as the progressive movement started, it became more common. And it wasn't until the very late 1800s that states began licensing doctors. But the reason why the medical profession wanted them licensed, the patients weren't going before the lawmakers saying, you got to license these guys. The doctors are going before the lawmakers saying, you got to license doctors because there could be other guys who are not as good as us. And that's not safe for patients. And so in other words, they verbally, they're saying, I want to protect patients. They're really protecting themselves from alternative, competition. And it's that way with a lot of other professions, ended up taking a cue from that. So the dentists then later on started saying, we got to get licensed, and the nurses, et cetera, et cetera. In fact, lawyers, does anyone think that Abraham Lincoln, who I don't think he went to beyond the third grade in education, formal education, and who successfully tried big cases before the U.S. Supreme Court representing major corporations, do you think he can get a license to practice law in today's world? I mean, he couldn't, because he didn't go to accredited law school and all that. So the most you'll see in history, almost never have people asked the legislators to license those guys to protect us. It's those guys who have gone to the legislature to say, you got to license us to protect them against people who are not like us. And so to this day, the AMA, which has lost a lot of membership, I think something like 15% of doctors belong, they advertise hoping to gain membership, saying we're aggressively fighting what they call scope creep. The term of art in legislatively is scope of practice. In other words, if a legislature is going to say we're licensing, let's say, nurse practitioners to practice, to give primary care to patients. Okay, we're going to license them. So then it begs the question, okay, so what's the scope in the law? What are you going to say they can do? How far can they go? Okay, so when it comes to doctors, once you get a license to practice medicine, that anything that comes under the rubric of medicine, you could do. But they fight other groups like nurse practitioners who've done advanced training, nurse anesthetists who've been providing anesthesia, in the military. And since they started the Mayo Clinic in the 1800s, and in 19 states, they could practice independently. But in the rest of the states, they have to work for or have some sort of supervision agreement and contract with a doctor. So these are all defined by the scope of practice that they're allowed to have. And the AMA fights vigorously and proudly tells it doctors, we're fighting to stop other healthcare professions from expanding their scope of practice to areas that they've trained to do. So a lot of us learned over the COVID pandemic that, pharmacists are trained to give vaccinations. But in many states until recently, you can average, I think almost everywhere in the country, you can go get a flu shot at your local pharmacy. But that's a new thing, because that was a scope of practice issue that originally was fought by the medical profession. So to me, again, as part of my oath, I say it's disrespectful of patients' rights and autonomy to use the lawmakers and the law to prevent people from having options. I mean, if you think that, let's say, a nurse practitioner isn't as good as you as a doctor, then make your case. I mean, just like if you think, a Toyota is better than a Nissan, then make your case. At the end of the day, the person should decide, the customer should decide what they want to buy. I might not even disagree with some of the AMA's positions regarding whether or not different health professionals are as good as doctors, but I disagree with them when they say you should not allow patients to be able to contract with those people for healthcare. That's their decision. Even if I think that they're making a mistake, that's their right to make a mistake, which is a great segue into another paper I came out with a couple of weeks ago. And we're having an online event about this a week from today. So if your listeners want to know about it, it's a thing called assistant physicians, not physician assistants, assistant physicians. So as probably everyone knows, there's a worsening shortage of primary care health providers in this country. It now takes an average of almost a month to get an appointment to see a primary care practitioner for primary care, nationwide average. And it's getting worse, more and more, not just physicians, but nurse practitioners, physician assistants, other people who could provide primary care. They're retiring and they're not being replaced at a rate to keep up with the population growth and the aging population growth, which is a part of the population that needs more primary care. I'm talking about primary care, everyday things, wellness, preventative care, vaccinations, diagnosing diseases. And then if it looks like it's kind of complicated, you could always refer to a specialist. So anyway, I don't want to go into it, it's too complicated, but has to do with a cartel of medicine. In order to get a license to practice medicine in any state in this country, you have to have graduated from an accredited medical school. By the time you graduate, you have taken step 1 and step 2 of the National Standardized Medical Licensing Test. You have to have completed, however, to get a license to be just a general practitioner or a GP, which is not a specialist. You have to have completed at least 1 year of a residency program and then pass step 3. Okay. Now, residency programs range from 3 to 5 years, some are even 7 years. So in my case, here, I'll give you my story. So I came to Phoenix, Arizona in 1976 after I graduated medical school. And in those days, interns and residents got paid even less than they do now. And I had a young baby. So after I completed my first year of my 5-year residency to become board certified as a general surgeon, I took step 3 of the licensing exam, passed it, applied for and got a license as a GP. I continued as full-time as a resident, but you do get once or twice, every couple of times a month in those days, you got a day off and you had some evenings off. And when you're that age, it's amazing what your body can handle. So that allowed me to moonlight and make some extra money working in urgent cares as a GP to help, support my new family. Totally. And that's the way it is to this day. Okay. So some states require now more than 1 year, but most states require just 1 year. All right. So in order to get into a residency program, they have what's called a match program. That's been around since the 1950s. It was designed by the AMA and the Association of American Medical Colleges. They created this program where when you're in your senior year of medical school, you interview with and rank in order of preference the residency program. And then the residency programs rank in order of preference the applicants. And on the 3rd Monday of March, there's match day where everybody's told, like an algorithm puts together and everybody gets their most likely choice. But what ends up happening is, since there are fewer residency slots than there are graduates, up to 10% every year are stuck without a residency program. And you have to wait a whole year again to do that match again. It's a once-a-year thing. So they're in limbo. They can't take care of patients. They can't hone their skills in a residency program, and they owe $300,000 in medical school loans. So what are they going to do until next year? So in Missouri in 2017 launched this great idea, And now several states have followed suit where they said, you know what we could do? You're already a doctor. You have your diploma. It says MD or DO on it. We'll let you work as an apprentice, sort of. They call it assistant physician, either in a doctor's office, a licensed physician, or in a rural area, you could work in a small town as long as you have a 24/7 collaborative agreement with another doctor nearby who could help out on a moment's notice. And you could do that, and then that'll help you gain experience and make a living. And then next year you could apply, you could try again for the match, or you could actually renew that assistant physician category. In case of Missouri, you could do that every year indefinitely. Several other states have adopted a similar thing, except because of organized medicine not liking the idea. In some states, they say, we'll let you do it for 1 year or 2 years or 3 years. But after 3 years, if you haven't gotten into a residency program, you're out of luck. We gave you 3 years. But in the case of Missouri, you could do this as long as you want. And so it accomplishes a couple of things. Number one, it's getting these people experience and helping them make a living. But on top of that, we have a shortage of primary care practitioners. So here you're increasing the number of primary care practitioners. In case of Missouri, assistant physicians added 3% to the workforce of primary care practitioners, and particularly in underserved rural areas in the Ozarks and such in Missouri. So it's a good idea in that respect. But I think it also, and I make this argument in my paper, okay, so if 1 year of residency in anything, whether it's general surgery or pediatrics or family practice, 1 year plus passing step 3 of the exam allows me to be licensed as a GP, not a specialist. If I want to be a specialist, I still have to go to a residency program, but maybe I like being a GP, and maybe the small town I work in, that's fine. And they know if a complicated case comes in, I'll send them to a specialist in the city. So I'm providing services. So if it's good enough 1 year and passing step 3, then why isn't, let's say, 3 or 4 years working as an apprentice plus passing step 3 and taking the continuing education courses that we all have to take to keep our license? Why isn't that good enough to be a GP? That's an interesting point that I raised. Well, of course, if that happens, then you have a different pathway to licensure, and you're kind of disrupting the setup that the medical profession has worked very hard for many decades to get in place. So it's controversial. And people who are interested in this, they can read my paper. It's on the Cato website. Expanding access to primary care, enable assistant physicians to practice. And you could just go to cato.org. In the search box, you could just say assistant physicians. It'll get it up for you. Also, this coming Monday at noon Eastern, from noon to 1 Eastern, I'm going to have an online event. It's online. Anybody who wants to could register.
You to register. Yeah, go ahead. I'm sorry.
It's at the Cato website on the homepage. You'll see it towards the bottom, events. And we're going to have a 1 hour discussion. I'm actually going to have on, among the people I'm going to have on is the legislator who got this passed in Missouri, who happens to be a board certified orthopedic surgeon and a legislator. And he's going to talk about it, as well as a practicing physician, assistant physician who's an MD. And then also having Kevin Deyaratna from the Heritage Foundation. That's a conservative think tank, but he's also done a lot of work on this subject, and he's published on this. And we're going to have a conversation and take questions from people who are watching. So I encourage people to, if you're interested in this idea. But again, this is one of those things where it gets opposition from, among other things, the American Academy of Family Medicine, family physicians. Family practice became it used to be that they were all just GPs. Yeah. Starting in the 1970s, family practice residency programs developed so that you had two options. You could become a GP, or you could go do a 3-year residency and become board certified in family medicine. So now the majority of family practitioners are board certified in family medicine, but there are still plenty who are GPs and didn't go and get board certified in family medicine. Becoming a GP doesn't mean you can't decide, you know what, I'm going to take some time off and go back and do a residency. I want to become a certified in this. But in the meantime, you could help a lot of people as a GP, and a lot of them are doing it.
Dr. Singer, I know you guys split in just a bit, but again, something like this, like you say, there's not enough at this point, and probably getting worse, I dare say, harder to find a GP, harder to find a primary care physician. I know they've got all the quick meds and all those things, but there's obviously a tremendous difference in having your physician that you're able to communicate with and go to on however regular basis, and the importance of expanding the access, like you were saying earlier. Do you get concerned about we were talking about the Hippocratic Oath earlier, and some of the places that these organizations are going, the cartel, if you will, when it's not best to be the people?
Yeah, I mean, I'm going to be a patient too. Every one of us, that's the great equalizer, right? Every one of us is going to be a patient, and everyone's going to have that day of reckoning, so to speak. And it's getting harder and harder for people to get access to primary care physicians, who tend to be like your initial introduction. Most of the time, if you got a problem, you want to go to a primary care practitioner first to kind of help you sort things out. If it may be something simple, or maybe something that the primary care clinician will be able to say, you know what, you need to see a neurologist about this. This is something in that area, and they'll get you to one. But right now, there's a particular acute shortage of people in primary care. And primary care is not just rendered by physicians. Like I say, they're nurse practitioners. In many states, over 20 states, nurse practitioners are not allowed to practice independently. In my state of Arizona, they could set up a practice. Wow. And there's a lot of good evidence suggesting that when it comes to routine primary care, the services they render, their outcomes are just as good as with physicians. So, and they refer if it gets complicated. Sure. As a surgeon, I get referrals from nurse practitioners when they think it's a surgical problem. So, but this is a worsening problem, and all of us are finding it increasingly difficult to get in to see anybody, or to talk to a live person and not some sort of bot on the phone. I mean, I'm sure everybody listening can relate to this. And so this is a real problem. And as long as there are efforts by their political lobbying by special interest groups, including my profession, to use the government to prevent new entrants into the field, at the end of the day, that's making it worse for all of us. Yeah. And I think whether or not that new entrant into the field knows what he or she is doing and is good enough for me, that's my decision. That shouldn't, at the end of the day, be the decision of other people. That's my decision.
I'm going to ask you again, respect to your time, Dr. Singer. You're very courageous in what you're doing. I've always felt this. You've got the intelligence, obviously experience, but it's courageous. You've got to get pushback. I've got to believe you get pushback.
Oh, yeah.
In your profession, be it the Hippocratic Oath, and these days, especially if something is socially or politically correct or incorrect or whatever. Tell me how you deal with that.
I guess I'd like to think I would have always been this way. I'm very committed to sticking up for my principles and being true to my principles. I have a real strong conscience in that regard. But I got to tell you, it's certainly easier when you're in this stage of my career where I have enough experience under my belt to look back and kind of call BS on people. And at the same time, I'm not at risk of people suddenly cutting off referrals to me because they're angry with me, because I'm at that stage in my practice where I don't rely on that. So I'd like to think I would have always said these things when they came up. I know I always thought these things, but it's certainly easier when you're not under any sort of pressure. So, for example, a couple of years ago, in the early days of the pandemic, the governor of Arizona got buy-in from the Arizona Anesthesiologist Association to allow nurse anesthetists to practice independent of anesthesiologists because because of the lockdowns, there was no access to care. And a lot of rural parts of the state of Arizona, they didn't have anesthesiologists, but they had nurse anesthetists who could do anesthesia in outpatient facilities. So we became the 19th state to allow nurse anesthetists to practice independent. California's been doing it for 20 years. So I get an email because as a surgeon, I'm on the email list of the Anesthesiology Association because I'm one of their customers, I guess, saying, when we agreed to this, we thought it was just during the pandemic, but apparently it's permanent. We can't allow this. This is not safe for patients. Please sign this petition. And so as soon as I got wind of that, I wrote an op-ed that appeared in the Arizona Republic, the biggest newspaper in the state, that said, I don't see what the problem is. I work with nurse anesthetists all the time. And if, as the anesthesiologists claim, they get in occasionally, they'll get a case that they're in over their head. Well, I'm a surgeon. I'll sometimes see a case that I'm in over my head. And what do I do professionally? I call somebody who knows more, or I refer them to somebody who knows more. Why wouldn't nurse anesthetists be any less professional? Well, I caught so much grief from, I mean, it was, some of it was getting really mean spirited and bad language from a lot of the anesthesiologists. But, you know, I'm at that point where I said, fine, you know, you don't want to work with me. You don't have to work with me. You know, I'm at that point in my career where it's not going to affect my income in any way. So, you know, say what you want. This is what I believe. Now, I would like to think I would have always done that. And knowing me, yeah, that's probably the case. But certainly,
little I know. I think that
has less cost.
Yeah,
it has less cost at this point in my career
but
to do that.
Again, that's wonderful. People can go. We've got the links up: wfmj.com, Louis Free Show, louisbfree.com, etc. But just go to Cato. You can go to cato.org, cato.org. Dr. Jeffrey Singer. And I just very quickly, if you don't mind, when you said that about politics and the politics and how things are with it, I remember again that same veterinarian, a friend of mine. People say, "Well, don't you know who he supported?" I'm not going to get into all the where his politics are. I said, so when you went to the Cleveland Clinic for cardiology, you asked your doctor who they voted for in 26. I mean, it's insane.
Yeah. I don't really care about that stuff. I just want to know, are you good to take care of my client?
That's right. You're amazing. And I love doing the gig with you, Dr. Singer. I'm so grateful for who you are in our world.
Well, thank you very much.
We'll do it again. Thank you.
Yes.
Folks, you can register for that for the next week